Hi, I am Don Kim, an acupuncturist in New Zealand and also one of the very few Korean hand therapy specialists in the world. Thanks for your interest in learning Korean hand therapy. This intro video is firstly about Korean hand therapy. What is Korean hand therapy? What conditions is it effective for? Why is it so powerful? Why is the perfect complement to acupuncture? And why is it also the best option to treat both your own condition and your family's? Secondly, I will briefly talk about my Korean hand therapy course, why it is different from others. And finally, I will introduce the video recording package I'm currently promoting. Korean hand therapy is truly the perfect complement to acupuncture, and I will explain why. But firstly, what is Korean hand therapy? As you see here, one hand represents the entire body. The palm side corresponds to the anterior side of the body, including all organs. The dorsal side, the posterior side. By stimulating specific acupoints on the hands, we can improve many conditions. What conditions is it effective for? Korean hand therapy is effective for almost any conditions, from pain to even cancer. It is especially powerful for pain, acute and chronic injuries, inflammation, and women's conditions. In these areas, it is second to none. Personally, I have numerous cases that prove this. And why is it so powerful? You won't believe how powerful it is until you experience it. For example, I fixed 30-year-old sciatica with just 2 Korean hand therapy sessions. However, the reasons behind its effectiveness are not explained in books. Through my own research and practice, I have discovered 5 key reasons. Especially the first 2 reasons explain a lot about why Korean hand therapy is so powerful. The reason 1, the brain map. The brain map here shows the close neurological connection between the hands and the brain. As you see here, about 80 to 85% of our brain is directly connected to the hands. So stimulating points in the hands has a direct effect on our brain and therefore the related body part. The reason 2, in many cases, the best place for treatment is where the problem is. However, with acupuncture, it is not possible to reach many areas of the body, like female organs, as shown in this picture. With Korean hand therapy, however, we can directly work on any part of the body, from head to toe. Now, let me tell you why Korean hand therapy is truly the perfect complement to acupuncture. Number 1, Korean hand therapy is rooted in acupuncture. So without acupuncture knowledge, you can't fully understand it or get full benefit from it. 2, Acupuncturists are in the best position to utilize Korean hand therapy because only acupuncturists can use four main tools and methods: invasive and non-invasive. Other practitioners are limited to one non-invasive method. And three, and most importantly, when you combine Korean hand therapy with acupuncture, you can improve many conditions that are difficult or impossible to treat with acupuncture alone. For example, I once treated a pregnant woman whose fetus was surrounded by many cysts. Guess what happened after a few months of Korean hand therapy treatment? To everyone's surprise, she gave birth to a healthy baby, and still more, all cysts disappeared. Personally, my practice has always been much busier than others, and the main reason is that I include simple Korean hand therapy treatments alongside acupuncture. Why is Korean hand therapy also the best option for treating yourself and your family? Some of us or someone we love suffers from some ailments, whether muscular or not. And it is not easy to improve these conditions naturally on our own. With Korean hand therapy, however, we can improve almost any issues, such as back pain, migraine, endometriosis, hypertension, insomnia, and the list goes on. And Korean hand therapy is the best self-treatment method ever for you and your family. Secondly, my Korean hand therapy course. My Korean hand therapy course is different from others. Why is that? Here are 5 reasons. Number 1, acupuncturist. To be a good Korean hand therapy teacher, you must also be an acupuncturist, because Korean hand therapy is from acupuncture. But most Korean hand therapy teachers worldwide are not acupuncturists. Learning from an acupuncturist who can comprehensively teach in English is essential. Number 2, experience. Korean hand therapy has existed for only about 50 years, so it's very hard to find a teacher with ample field experience. I have practiced and taught it for nearly 40 years. Field experience is vital because much of what's written in books or taught by inexperienced teachers is not practical or even correct. Number 4, training. I learned directly from the founder, Oriental Medical Dr. Yu, and trained at the Korean Hand Therapy Wellness Center with Dr. Kim, who was the best practitioner at the time. There I learned lots of unique and valuable knowledge and skills that are unknown to other teachers. Number 4, practical value. Much of what I teach comes from decades of hands-on practice and special training. It is practically useful, but not found in the books or taught by other teachers. Number 5, learning time. It usually takes months, even for Koreans, to properly learn Korean hand therapy in Korean. But I condensed the content a lot by removing abstract or impractical parts. So in less than 20 hours, you can learn all key aspects of Korean hand therapy. I had an interesting experience with a couple of acupuncturists in Asia. After seeing great results, They first learned Korean hand therapy for about 40 hours from two non-acupuncturists. However, they were not confident, so they flew to Korea to learn directly from the Korean hand therapy main office. But the office couldn't find the teacher who could teach them in English. Eventually, they found me and flew to New Zealand and learned from me, and later left a fine Google review. Lastly, let me introduce the video recording package. The recordings consist of 4 modules covering all key aspects of Korean hand therapy. Modules 1 and 2 are mainly for pain and musculoskeletal conditions, and modules 3 and 4 are mainly for non-musculoskeletal and emergency conditions. The package I'm promoting now is for modules 1 and 2, and it costs 390 New Zealand dollars and comes with 9 tool videos and 14 captioned videos, and 2, a comprehensive e-workbook 1, which is translated and adapted from 13 Korean hand therapy books and more, and 3, PowerPoint teaching materials 1, and 4, a 40% discount voucher for online consultation. You will learn a lot of new and practical knowledge from this package, and I'm confident you will be able to improve many conditions that were previously difficult or impossible to improve. I also believe the videos and e-workbooks will become valuable resources for you and your family. I'm very happy to share with you decades of my experience and expertise, especially before I retire. If you had any questions, please email me at oawcentre, CENTRE, @gmail.com. Thank you for watching.